There's one thing, danger in unsafe spaces where people are not observing COVID regulations is another. Health Minister Dr Zwelini Mkhize says government may have to review current lockdown restrictions and consider further measures to curb the exponential spread of the COVID-19 virus. The minister's remarks come as South Africa recorded 14,046 COVID-19 cases on Wednesday alone at a positivity rate of 26%. This brings cumulative total of cases to 954,258. The Health Department also reported an additional 411 COVID-19 related deaths, which brings the total to 25,657 deaths. Dr. Jeremy Nel is Head of Infectious Diseases Division at Helen Joseph Hospital at Wits University. A very good evening to you, and thank you so much for speaking to us, Dr. Nel. Just your experience, I think for every South African, we either have similar or disparate experiences. What are you seeing out there with regards to how people are behaving, even after they've heard that not only are we officially in the second wave, but that there's a new variant of the coronavirus?
Yep, thanks for having me. It's certainly somewhat dispiriting as a healthcare worker sometimes to see how laxly some people are taking the advice to really make sure that we're good about things like social distancing and wearing masks and really avoiding these big social indoor events, especially around the holiday season. We're seeing. Sorry.
No, go ahead.
So we're certainly seeing a lot of non-adherence to that. And it's understandable. It's the holiday season, and people do need to relax after a tough year. But it's really the worst time for it. Given that the second wave is more or less at its peak in several provinces already.
And I was just relaying to my colleagues that we know that areas like Sandton have become one of the epicenters in Gauteng, including I think Bedfordview. Is it because people are really failing to grasp the seriousness of the second wave, or I'm not sure if I actually believe that fatigue is enough to explain the recklessness of people. And it's not just in informal settlements, it's in established areas where people would so-called should know better. Why are people refusing to wear masks?
It's a very, very good question and a very difficult one to answer. I think one is the COVID fatigue, which has just been, we've been in a lockdown more or less since March, to varying degrees. And I think it's also it's the particular period where people really historically have been able to relax and get together with friends and family. And I think there's a lot of resistance at the end of a long year to preventing, to stopping that this year, when it really is necessary. I mean, it's not just that, we are facing a new variant which is more transmissible, which certainly drives some of this. Even if with the best adherence to all of these measures, we would still be having a second wave. But really, it's about doing what you can to try and mitigate the worst of the second wave and try and prevent the hospitals from being overrun, which, frankly, they're coming very close to. I mean, in many places around the country now, we're already having higher peaks than we ever had in the first wave, and hospitals were struggling enough in the first wave. So it really is a terrible time for the second wave to be peaking, and really does speak to the need to be as good as we can to prevent the super spreading type events. We're not going to prevent all transmission. You're always going to have a second wave, but the key is to try and avoid those sort of high risk environments and high risk scenarios, which drive a lot of the infections.
Now, we know that this new variant is likely to be more contagious, but it's apparently said that analysis shows that it shares some of the mutations of the new strain, that is a COVID-19 that we know, but that the two viruses have evolved separately. So just explain that to us. What does it mean?
Sure. So all viruses naturally change with time. They always evolve in ways, in various ways, but it's not always that change, that evolution means anything in terms of how severe the virus is or how transmissible the virus is. So although the mutation process is normal, what's happened in South Africa and in Britain independently is that the virus has changed in a way which seems to be increasing its spread. So it makes it more likely that it spreads from person to person. And although it's not 100% determined yet, it's probably 80 to 90% confidence in my head. And I think that's driving the rapidity at which we're seeing the second wave. We really had almost no second wave in some places. And then, this has this is increasing so fast, even faster than the first wave at the moment.
I mean, then let's forecast a couple of weeks later. The minister has said that we're likely to see a lag from the holiday period. But given this fact that you're also highlighting, what is the scenario then if we're going to be looking at figures, let's say in 6 weeks' time, if we're at 14,000 now a day, what is likely to happen over the next couple of weeks?
It's a very good question and a very difficult one to answer because it's very hard to forecast this. What I can tell you is that with the possible exception of areas in the Eastern Cape, certainly the other provinces, Western Cape, Gauteng, KZN, which are really shooting up at the moment, are showing no signs of peaking yet. So this is still going up. Where the peak will be is very hard to determine. But I'm very worried with the fact that it's coinciding with the holiday period, with people getting together and the travel across provinces and with different groups. This is really the worst time. I'm extremely worried about where this will level out at the top.
And the minister is equally worried. He says he fears that daily averages could peak at 20,000 daily infections. But I want to focus on what you just said about the with the exception of the Eastern Cape. So all provinces are increasing in their caseload. Why do you think it is that the Eastern Cape is not? Is it because the situation is managed, that they are under some lockdown of sorts?
I should just to clarify. I mean, it is still going up in the Eastern Cape, but it may, if you look at some of the graphs, it may be leveling off towards its peak soon. It's still going up though in every province. So, and I think that is unfortunately the natural history, whether you do anything or not, is that this will peak and eventually come down. But the key with behavioural interventions and we're using things like masks and social distancing is to make sure that peak is much lower than it otherwise would be. I think the Eastern Cape has had a very rough ride of it, but and it's not over yet. I mean, it's still going up in the Eastern Cape, as well as all the other provinces at the moment.
And it's interesting that you should say that because the Health Department has said that all provinces, with the exception of the Eastern Cape, continue to report increases in their cases. So what you're saying is the difference is that it seems to be nearing its peak. So then let's talk about what those who are in provinces with rising cases can do. I mean, as we mentioned, the non-pharmaceutical interventions are there for us. It's in our hands to practice. People are not doing that. What can you do to protect yourself when other people are not protecting themselves?
Sure, and that's a great question. And the good news about the new variant is that the things to do are the same as they were before. That hasn't changed. So the same messages we've been getting out, since the beginning of the epidemic are the ones that apply now. The new epidemic, the new variant being more transmissible just means we have to be even more cautious about those sort of things. But the same things, wearing a mask, keeping a certain social distance, avoiding big indoor events, especially big events in general, but particularly indoors and particularly in poorly ventilated places, where hand hygiene, things like that, all of the things that you've heard the whole year are still applicable, and they're just even more important because of this increased transmission. But the good news is that the things that worked last time will continue to work if we apply them, and the real challenge is to get people to apply them over a very difficult holiday period.
All right, thank you so much for speaking to us, Dr. Nel. Much appreciated. Dr. Jeremy Nel is Head of Infectious Diseases Division, Helen Joseph Hospital at Wits University.